Do I need a speaker? No, I'm pretty close, I know.
Yeah, no, I should be fine without it.
And then you still want to press broadcast.
So it's already recording currently. So you can, that way you don't have to worry about it. And then now go back to screen share.
I wouldn't have time to film Ting right now.
Maybe.
Do you want me to move?
Potentially. Yeah, that's right.
Yeah.
That's right.
Alright, let's do it.
Oh, I just had a chocolate.
How come that's already up on Facebook?
So it's just preparing it.
Okay.
So you haven't closed when you press
Press
that.
to go live, it's like, I'm like, it's already there.
This is about to go live.
Yeah, in live.
Cam live.
Always. Yeah.
Alright, you good?
Yeah.
Alright, 3, 2, 1. Oh, that's a photo. Sorry. 3, 2, 1.
Hey guys, Cam here for the third part of the 4-part series on imaging, where we'll discuss everything you need to know about X-rays, MRIs, CT scans, and ultrasounds. Today we'll discuss diagnostic ultrasounds. So, how is an ultrasound created? Ultrasound imaging is based on the same principles involved in the sonar used by bats or even fishermen who use fish finders. When a sound wave strikes an object, it bounces back or echoes. By measuring these echo waves, it is possible to determine how far away the object is, as well as the object's size, shape, and consistency. This includes whether the object is solid or filled with fluid. Hey, that's 1 page 9 out of 3. How good is reading on? 1/3 done.
Do you want me to take one?
I think that's the first time I've ever been able to read.
Yeah, it's good writing. Nice and big.
You see that? How was I holding this now?
I know, but brilliant.
Alright, ready, go.
So let's talk about why we would use an ultrasound. So ultrasound imaging can be used to assess soft tissue structures that are relatively superficial, such as muscles, tendons, ligaments, nerves, and joints throughout the body. If your physiotherapist makes a clinical diagnosis of a grade 2 or 3 tear, an ultrasound may be ordered to confirm. Your physiotherapist has the skills to determine the severity of an injury, with or without the use of an ultrasound. And at Target Physio, we also use ultrasound during a treatment. So this allows us to see the working of muscles, such as the pelvic floor, in real time. Being able to watch the muscles moving helps the physiotherapist be very crisp. No, that's all right. We can start from there. Right.
Ready, go.
Being able to watch the muscle moving helps the physiotherapist be very precise with treatment and also has tremendous value for the client who is able to watch.
Alright. 3, 2.
Now, ultrasound is reflected by bone and unable to detect fractures. Ultrasound waves are also progressively disturbed the deeper they go, so the image integrity is limited for deep structures. Unlike CT scans and X-rays, there is no radiation with ultrasounds, and there are also no known risks associated with this form of imaging. Now, in terms of being referred for an ultrasound, most health professionals, such as referrals by physiotherapists and GPs, are available by Medicare. So thanks for watching, guys. The final part of our series will be on CT scans, and that'll be next week. Thanks for listening. That's it. Thanks for listening twice.
That's okay.
All right.
You said thank you very much, thank you.
Oh yeah, nice, done. Damn,
That was so quick.
quick as ever.
You're on fire.
On fire.
That button's gone now, won't it? It's like.
I didn't have good technical issues with that. So you can be with mama you didn't tell it. Do I need to click this button here? What? It's the best choice. Yeah. And do I have to say share tools? No, I don't think so.
Where is it? No, where it went. No, it's
Just
here.
because of my just because of my.
She said she
I filled it. I charged it completely this
Oh,
morning.
you didn't.
I reckon you could even like 5:59.
Okay, so what do? Go live.
Can you have patience?
Glad.
So press go live on Facebook. So press go live and then here. Okay, broadcast.
So, yep, we're live now. Okay. So if you go to your thing.
Why is it not on Zoom?
No, because you're on screen share.
Okay. Welcome. We're just waiting to see how many people show up and then we'll get started. So we'll just wait another minute till 6 o'clock clicks over. Okay, welcome to the Vestibular and Balance webinar. My name is Heather Butterworth and I'll be giving you a bit of information today on the vestibular system and common conditions and how we can help you out with those conditions. So let's get started. So what we're going to start with is some stories of people with dizziness that I've seen and their complaints that they've explained, and they might give you some sort of idea what you are, what you're experiencing if you've had dizziness, and how we can help you with it. So Veronica is my first one. Because it's vestibular, I've started with all V names. Veronica, her explanation of dizziness was she woke up in the morning, rolled over, and suddenly felt like the world was spinning around her. It only lasted for a few seconds at the time, but it keeps happening whenever she moves her head in those certain directions. The next client, his name was Victor, and he started feeling dizzy 2 days prior to coming to visit me. The dizziness felt worse when he was moving around, but it was a constant spinning feeling, and it was making it very hard for him to keep balance, and he was feeling very nauseous with that. Vanessa complained of having dizzy episodes that came and go. She had it 2 times, and they're about 2 months apart. The first one lasted for 30 minutes, and the second was most of a morning, so, you know, a couple hours. During that time, she had low-pitched roaring sound in her ear called tinnitus, and thought that her hearing wasn't as good as normal. She felt off balance even after the dizziness stopped. Vance was the next client of mine, and they've been talking about gradually feeling more and more off balance over the last few years. He was an elderly gentleman and had then had a fall the week before coming to visit me. He was worried that he was going to have another fall, and that just felt like that was part of getting old, and it was something he had to put up with. So the first bit I'm going to go through is what is the vestibular system and how does it work? Okay, so we've got the beginning of the anatomy here of the vestibular system is this picture, and we've got 3 semicircular canals that sense movement in 3 different planes. So I've got my little pointer on them here. We've got our inner ear, our eardrum, and then in from there is this is the vestibular system here. And the 3 semicircular canals sit in 3 different planes. So they sense movement, as you can imagine, on those particular planes. So imagine them as a little circle. So they say semicircular, but we're going to say they're circular for this, just to make it easier to understand. As we're moving in the plane of that canal, it moves back and forth, like so. So these canals are filled with a fluid that's lined with really fine hairs that sense, as the fluid moves past the hairs with a head movement, that stimulates these hairs to send off an electrical signal to the vestibular nerve, which is just in here, that then shoots into and goes to our brainstem and information to our brain about where our head is in space. So as I said, the hairs convert the movement into electrical signals that tell us where our head is in space. Sorry, just pressed the wrong button for a second. I'll just go into... Okay, so, oops, went back a slide. So what does the vestibular system do? So what it does is it assists us with postural control, which means it keeps our head upright. It senses and perceives self-motion. So when our head is moving, the fluid flows through those canals and lets us know where our head is in space. It also helps us to orientate to vertical. So moving back to that previous slide, we have a spot in there that is called the utricle, which is this little space here. So in there, not only do we have the fluid and those fine little hairs, we also have a little membrane that we have otoconia crystals that sit on them, which sense our gravity. So when we are standing upright, that pressure down onto that membrane tells us where we are in space, and also in gravity, whether we are upright or slightly tilted. So moving next back to that previous slide. So that helps us to orientate to vertical. So pressure down onto that membrane tells us where we are there. So it helps us assist with maintaining our control of our centre of mass and maintaining balance like this lady in our picture. It also is really an important controlling mechanism for our vestibular ocular reflex. So this is a reflex that is responsible for maintaining our gaze stability. So you imagine when you can turn your head and you have your eyes focused on an object, that our eyes are able to keep that focus. So what's happening right now as I'm doing this is that the vestibular system is sensing our head movement, sending a quick message to the muscles around our eyes and telling them to stay still on that object. So it's a really important one for keeping us feeling like our world is still. If that's not working so well, sometimes we can feel like we're just off kilter a little bit. Okay, next. So coming back to our people we were talking about. First, we want to go back to Veronica. And Veronica was diagnosed with something called BPPV, which is benign proximal positional vertigo, which is when that hardened otoconia crystals, which I was talking about in the utricle of the vestibular system, they can sometimes break off, and then they get into the semicircular canals where they're not supposed to be. So if you can see in this picture here, they can float up and around and get into the semicircular canal. So as you can imagine, as you're moving your head, instead of that normal sensory input and the fluid moving over the hairs, we have a little extra crystal moving around in there. This can cause the hairs to bend over more and get a bigger stimulation to that nerve, saying that you've had a huge movement when your head is actually moved in a normal plane. This gets confusing for the brain when one side is saying we've moved normally and the other side is saying, no, 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 we've moved a huge amount. This causes dizziness. So we get brief episodes of rotary vertigo, which is like the world is spinning around you, which can last for normally less than 30 seconds. It's normally around 5 to 10 seconds, but is really commonly provoked by head movements. Like Veronica was saying, rolling over in bed would set off that world spinning dizziness. You get nystagmus, which is involuntary eye movement, which is set off by that vestibular ocular reflex, which we were talking about previously. You also get nausea and vomiting from feeling off balance and dizzy. Okay, so BPV treatment is determined by testing to see which canal and what side of the vestibular system is affected. So we have 3 semicircular canals on each side, and so we need to test which canal is affected and which side of the vestibular system is affected. And from that testing, we are then able to decide which canalith repositioning technique is needed. So the technique is dependent on the canal with the pathology and the side, as I mentioned. So this involves a series of head movements that get the crystal to move from within the canal back around into the utricle where it came from. So if the crystal is in this little spot where I have my marker, it can't just go back into there because there is a block at that point. So we need to get it to flow all the way around back into there. Often then on retesting, you'll no longer have dizziness symptoms. Treatment is normally done in one consult. We will normally do 3 lots of the maneuver just to make sure that all of those little crystal particles are back where they belong. Sometimes it will take 2 or 3 treatments to get them all back, but symptoms should reduce following the first. Following treatment, then if they've come for a recheck and you're back to normal, I do also like to check your balance out. Because your vestibular system is so important for maintaining balance and giving you information about your balance, I like to check that you're functioning well and that if there's any little deficits, we can give you exercises to bring you back to speed. Victor is my next person. He was the one that presented with acute onset of rotary vertigo, so world spinning, but instead of lasting for a small amount of time like the BPPV in the last one, he was having prolonged dizziness over 2 or 3 days. Often with this, people will present to the emergency department because they're not sure if they're having a stroke or anything with more sinister. There's no problem with that. It's good if you think you're unwell but you need to be going to emergency, by all means head on to there and get checked out, be cleared for any of those more sinister things. So he also had nausea and some vomiting, and felt just like his symptoms were at the worst, couldn't stand upright. So vestibularneuritis is a condition of the inner ear where the vestibular portion of the vestibular cochlear nerve, which is here in this picture, has got an inflammation. So as you imagine, the information coming from your vestibular system is going through this nerve. But if it's inflamed, there will be a slowing down of that signal, and sometimes a complete loss of one side of your vestibular system, which can really put you into quite a dizzy, unwell state. Vestibularneuritis can be preceded by viral infections, and sometimes people will present with it when they've not been aware of having any sort of viral infection beforehand, but it's been set off. So sudden onset of prolonged rotary vertigo, world spinning, 1 to 4 days in duration, exacerbated by head movements, nausea and vomiting, and in some cases quite extreme imbalance. So treatment for vestibularneuritis in the acute stage is bed rest. Your GP, or if you've been to the emergency department, may prescribe vestibular suppressants and steroids to take some inflammation away. When feeling able in this stage, we like to return to gentle movement and activities of daily living as you're able. During the recovery stage is when I'd probably see you. And sometimes we can be left with a little bit of a unilateral hypofunction. So your vestibular system and the nerve signal isn't working as efficiently as it normally does, which can leave you with much lower levels of dizziness to what you're experiencing before. And the problem with this is often people think because their dizziness has reduced so much that I won't do anything about it because I feel much better than I did before. But we don't want to be left with those little bits of dizziness to deal with just in our day-to-day life. So it's definitely worth coming along and seeing if there's anything we can do. So our treatment at this stage is doing some vestibular and balance rehab therapy to encourage compensation for that side of your vestibular system that isn't working as sufficiently as it was before. And at this stage also, if we can wean off those vestibular suppressants to allow the compensation to be happening and to get you back to normal as soon as possible. Okay, so my next one is going into Vanessa. And so she was the one that presented, and her story was around having 2 episodes of a dizziness, some ringing in her ear. It was a low-pitched roaring sound, and she had some imbalance. And the first one lasted for about half an hour, but the second one was more a couple hours. So with Vanessa, and she also mentioned, that she had some dizziness between those 2 more serious dizzy spells, where she felt just a bit off balance. And she was diagnosed with Menieres disease. So Menieres disease is a vestibular condition where there's an increased amount of the endolymph fluid within the vestibular system. So this can cause attacks of vestibular symptoms, including dizziness, fullness of the ear, rotary vertigo, so that world spinning vertigo, loss of balance, nausea, and hearing loss. So we'll often talk about Menieres coming in attacks of dizziness. And that is due to the variability, the ability for that fluid to fluctuate. So when it's at its fullest pressure, your symptoms are going to be much worse. It then can fluctuate and go back down, and you can have spells of no symptoms at all. During these times, you might think, oh, it's all completely gone away, and then in a month, it can be a month later that then you're getting symptoms again. So it's important to, go to your GP for this one and have it assessed. So the diagnosis is usually diagnosed by an ear, nose and throat specialist. You'll also often go to an audiologist to check that if you have had any hearing loss during your attacks. Treatment from the ear, nose and throat specialist will be discussed at that time. There's medical treatment as well that can be offered for you. The physiotherapy treatment that we help you with is dependent on the deficit. So it's such a variable condition, this one, with some people being left with dizziness all the time and feeling off balance, whereas others will feel perfectly normal between. So that each person has a different approach for them. And dependent also on the stage of progression. So over time, with repetitive attacks of the vestibular system with Menieres, the vestibular system does have a reduction in function. So at this stage, if there is a loss of the vestibular system, then we look at getting some compensatory strategies around not having that information going to the brain anymore. So this is all done through the vestibular and balance rehab therapy, and I have a slide a little bit later on that goes through all the different strategies that we put in place. Okay, so the last person that we discussed before is Vance, and Vance was describing his changes that he'd been experiencing, that he'd been feeling a bit more off balance over the past year or two. He recently had a fall, and he was concerned that he would be having another fall, but thought that this was just a usual changing of getting older, that he should just put up with it and there was nothing much we could do for him. And I don't like when people tell me that. So we've always got something we can help with. So the cause for Vance's changes in his balance and slight dizziness is disequilibrium of aging. So what happens to the vestibular system as we age? We get a reduction in the number of hair cells within the vestibular canal, but we also have a reduction in the vestibular neurons in the nerve pathway, so it gets a little bit of a slower message than it used to. The blood flow to the inner ear is reduced. The otoconia in the utricle can become a little bit more brittle. So we get to have sometimes a higher risk of getting BPPV, where the crystal flows into the wrong part of the vestibular system. And if we have a bilateral degeneration, we can have a loss of balance, but without any dizziness symptoms, because both sides are still saying the same message to the brain. Treatment for this, again, we're going back to that vestibular balance and rehab therapy, focus on specific deficits the person is presenting with. And I also like to go into education on safety to prevent falls. So looking around the house for possible dangerous scenarios, having handrails, and also, lighting at night. So when it's darker and we don't have our visual input, we have more reliance on our vestibular system. If that's not there, then we prefer to have some lighting at night so that we've got a lot more input and less likely to have a fall. Okay, so I've been talking about this a little bit, and now we've got to the slide. So the vestibular and balance rehab therapy. The basic treatment principles that I go through, depending on the condition and what you're presenting with. So adaptation is where we look at, especially when we were talking about the vestibular neuritis before, sometimes we can have symptoms that last the neuritis has cleared up and we'll have some deficits left behind. I've had some people explain to me how they have a sensitivity to movement. So just bending down and standing back up, they'll get that dizziness come on. Also, other people have explained dizziness of as you're walking through the supermarket and you're trying to focus on what's on the shelves and walk forwards at the same time. And this will bring on a dizziness as well. So different things that need to be addressed for every client that comes in. So adaptation is where we look at our gaze stability. So our vestibular ocular reflex that we were talking about earlier, and aiming to rehabilitate that if we have one side that has had something happen and it's not working as well. And progressing to increase the difficulty of those exercises by incorporating postural challenges along the way, standing on one leg while we're working on our vestibular ocular reflex. So the next one is habituation. And so like I was talking about just a minute ago, where we have people who are sensitive to movements of self-movement and also visual movement. So, walking through the supermarket, standing up and bending down. And we start to give you exercises that habituate you to those environments that cause your dizziness. But we start off gently. We don't like to provoke your dizziness to the point where you can't function for the rest of the day. And we build up from there to get you back into those environments or those movements that have been causing your dizziness. So substitution is the next one, and this is more for when we're talking about our patient with Menieres, whether if there's been a loss of the vestibular system and there's no longer information coming from that part of our sensory system. We look at other areas of the body that can help compensate for that loss. So for example, with our vestibular ocular reflex that keeps our gaze stability, we can try to train our cervical ocular reflex. So the muscles in our neck have receptors that can help with that reflex. It's much slower, but it's better than not having anything to help you with that gaze stability. The last one is balance retraining and postural control. So balance is one of those things that as we age, it does start to decrease, but it's something that we can always train and get better at. So if we are challenging our balance system, we are always improving it. If we're leaving it go and ignoring it, like my last man who said, I think it's just part of getting old. That's not okay. We need to be keeping on working on this balance all the time. If we are always challenging it, we can keep on improving. And if not improving, we're just maintaining so that we're staying safe in our houses. And so we test each person separately, see where they need to be working on their balance, and give them exercises to be completed at home in a safe environment so that we can keep working on that. So I guess moving on, the main moral of the story for today is that I've had a few people lately saying that they thought their dizziness was something they just needed to put up with, or that their balance that they feel like is deteriorating can't be helped, and it's something a part of aging. I'd like to just always say, if you're having something that isn't, feels like it's not getting any better or not changing, or you're having fear of falling, then definitely go see your GP or your physio and have a chat, see what they can do to help. So now we'll be just moving on to see if anybody has any questions along the time. So if you have any questions, you can type it into your question and answer spot on the messenger. All right, so the first one I'm just read through is, would BPPV, the first type of dizziness we discussed, can that go away on its own? And it actually is possible. So those little crystals that are floating around, they do actually reabsorb into the fluid they are floating in. The only downside is that it can take, 1 to 2 weeks, and that ongoing dizziness and that time can be quite debilitating, hard to go to work, hard to just function in your normal life. So if that is something that you've ever experienced, it's better to come along, have a test done, see what treatment we can help you with, just to bring that span of time down and let you get back to your life a lot quicker. Okay, so there's another question here about how do I know whether I should be going to into the emergency department if I've had a sudden onset of dizziness. And so that is definitely something, if you feel like you're having a medical problem and you're not sure what's going on, and you would prefer, it's always best to go to your emergency department and have yourself cleared. Sometimes in emergency there are physios that treat vestibular conditions and they can help you straight away. So it's a great thing to go on and make sure you're cleared. And then if you do have any vestibular complaints, you can come and see us later. Next one is, how do I make an appointment? So you're welcome to, my contact details are on this last question form, and the phone number is there, 32025216, and you can ring up and make an appointment. Next one. Sorry. Is there a relationship between physical condition or diet to vestibular conditions? So the vestibular system, with Menieres, there is some research around changing your diet to change the amount of fluid build up in your ear. It has mixed results, and I guess that's something that if you had the condition, it would definitely be worth trying to see it improves your system, your symptoms. In general, it can affect your balance, your physical condition, because any sort of balance requires strength and power as well as your sensory system. So, but as for BPPV and things like that, I don't think it affects it hugely. So sorry if I have had quite a few questions. Sorry if I haven't been able to get to all of them. If you have any questions that you would like to ask me and I haven't got time to get to, you are really welcome to email me on that email I have up on the final page. It's heather@targetphysio.com.au, and I will email you back some answers. Thank you very much for all your time tonight. I hope that this helped you understand the vestibular system, and if you've been experiencing dizziness at all, give you some answers about what might be happening. And of course, if you ever need any help, please let me know. Thank you. Did I stop the Facebook one? How do I do it? It's black. It just has a black screen.
You just shifted it.
It's just black though.
You literally have to stop it. Can you stop the live stream?
How do you stop? Cam, do you know how to stop it? It's just gone blank.
I was supposed to be checking if there's more questions. Did you want to answer any more questions?
Can you put a thing in there? I apologise, the screen is all blank.
Yeah.
I love technology. Okay, you come back.
What?
Oh, here we go. But it's just on the go live.
We apologise. We've had technical issues.
Stopping the live stream.
It was shut the lid.
It didn't work.
I think it's just a lag. Am I on? Oh, yeah. That was a mental one.
Is it working?
Good task. Is it task manager?
Your laptop. And